welcome to another edition of the SABC News COVID-19 Global Wrap. I am Busisiwa Khatebe, and this week I bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. However, before we delve into it, let us have a look at some global stats. The world has currently recorded over 565 million COVID-19 cases, with over 537 million recoveries and over 6.3 million deaths. South Africa has over 3.9 million confirmed cases, with 3,889,998 million recoveries and 101,915 deaths. Africa has so far recorded over 12.4 million cases, with over 11.5 million recoveries and 256,378 deaths. The World Health Organization said on Tuesday that COVID-19 remains a global emergency, nearly 2.5 years after it was first declared. The emergency committee, made up of independent experts, said that rising cases, ongoing viral evolution, and pressure on health services in a number of countries meant that the situation was still an emergency. Cases reported to the WHO had risen by 30% in the last fortnight. The Pan American Health Organization, or PAHO, warned of the growing number of COVID-19 cases caused by the highly infectious BA.4 and BA.5 Omicron subvariants of the coronavirus. This is despite overall cases dipping in the Americas. There were over 1.5 million new COVID-19 cases in the Americas last week, representing a 0.9% decrease, while deaths fell by 3.5% to 4,789. PAHO Director Dr. Carissa Etienne has since urged countries in the Americas to reintroduce public health measures like the use of face masks and social distancing when cases spike. In Asia, a new wave of coronavirus infections is rapidly spreading through Asia. In Japan, this has prompted warnings to take precautions to slow the outbreak and help prevent healthcare systems from being overwhelmed. Japan reported almost 95,000 cases on Wednesday, and newly infected patients have increased by twofold compared to the last week. And as cases soar in Tokyo, government raised its alert level to the highest tier. Meanwhile, in South Korea, daily cases by Wednesday had tripled in a week to more than 39,000, and officials and experts expect cases in the East Asian country to reach 200,000 by around mid-August to end September. And lastly, in Europe, the Medicines Agency, or EMA, on Thursday identified severe allergic reactions as potential side effects of Novavax Inc.'s COVID-19 vaccine. The vaccine was authorized by U.S. regulators on Wednesday, and its product label in the States warns against administering the shot to people with a history of allergic reactions to any components of the shot. The EMA said it would also update the product information for the vaccine to add unusual or decreased feeling in the skin as a new side effect.